Child and adolescent mental health is the foundation of a strong, vibrant and healthy society. Now, according to the Children's Institute, investing early to promote children's optimal mental health and well-being is one of the best investments we can make in our future prosperity. The Institute says this offers an opportunity to break the cycle of poverty and unleash children's potential. Now, the Institute, in association with various universities, academic bodies and organizations and foundations, have brought out the latest child gauge, the 16th annual review of the situation of the country's children that was published just before we started celebrating Youth Day, or marking Youth Day, I probably should say. And it makes for very, very stark reading. To discuss this further, we're joined by Professor Mark Tomlinson. He's the co-director of the Institute for Life Course Health Research at Stellenbosch University. Thank you, as always, for your time, Prof. And I feel like there's almost a continuation of the various discussions that we've had that brings us back to basics every time, and the state of the life that the average South African child is able to live, which for me is an indictment on our society. And I almost feel like that's where we left off our last conversation, and the findings of the child gauge just bringing it more and more home that we are letting our most vulnerable down. Just some of the statistics that is part and parcel of this report says almost 2/3, that 63% of children in South Africa live in poverty, 39% live beneath the food poverty line, and 4 out of 10 have experienced physical or sexual sexual violence, rather. If you look at those statistics alone, it means that children, so many children in South Africa are living through a trauma of some kind while growing up, which of course means it has to have an impact on their mental health. Paint for us a picture of where you see the average child in South Africa right now.
Thanks, Marcel. I probably want to start and actually say one of the things we tried to do in this gauge is try to, right at the beginning, try to clear up some of the issues of definition around what's mental health, what's mental illness, what's mental disorder, because people often will, for example, talk about mental health, but in fact what they mean is mental illness. And the way in which we tried to clear some of that up and to paint a different kind of picture is to use the idea of a continuum in that on the one hand you might have people who have children, adolescents who are healthy, they're content, they sort of meeting their full potential, and on the far other end would be children, adolescents who, for example, have a particularly severe mental illness. But everything that happens in between that is about all of us. We all move. As we get stressed, for example, we move a bit along. We then get support from our families. We may then return to the happy side of the continuum, if you want to put it that way. But part of the aim of the gauge was firstly to clear up some of those definitional things, to, in the process of that, try and destigmatize some of the issues. Because one of the things we find when you talk to children and adolescents, having worries that you feel, for example, that you may not be in full control of, there's such a stigma that even talking about it with a parent, with a friend, with a teacher might be quite a difficult thing to do. And so that was the first step that we tried the first step we made in the gauge. Importantly, then, it wasn't just, and you're perfectly right, children and adolescents and youth. As are the rest of us, there's a lot going wrong. But you also didn't want to just paint the bleakest of pictures, because in fact, despite all of that, in fact, so many children living in poverty, so many children experiencing sexual violence, for example, because many of them remain in supportive families, because many of them do go to schools where teachers are trying, despite difficult conditions, to create a safe, a learning environment. And so many children and adolescents actually, because they're in a way held, because they're in these enabling environments, actually show remarkable resilience. And we also wanted to show that. So it wasn't just about the bleakness, which we all know is there.
And that is really the title of this year's study or review, as we call it, Promoting Sustainable Livelihoods and Resilience of Young People for a Better Tomorrow. Now, if anything, South African young youth have been expected to be resilient, such as the circumstances that most of them grow up in. But what is there in the structures? You spoke about the almost informal structures that are in place, the teacher that tries their best, or the youth leader that tries to get the help that they could potentially reach out for. But what are the official structures that are currently in place, and where is the biggest need? Now, according to some of the reports that was written and according to the study, I mean, we know from just covering mental health during lockdown or during the pandemic, we've got a massive shortage in mental health care workers in South Africa. That's just for the population as a whole. But apparently the issue is even worse when you look at specialists who work with children and adolescents. There's one statistic that says there's less than 60 specialists in child and adolescent psychiatry in South Africa, and most of those work in the private sector. So what structures, official structures, are actually in place to help children that need help in the mental health sector?
Sure. I mean, you're absolutely right. There are significant limitations. You know, the Western Cape, for example, and Gauteng have perhaps, as in many other instances, have the best services available. You know, in the Western Cape, there's residential units for child and adolescent mental illness. But even those are far below what is needed. So what happens is that when adolescents get diagnosed with a significant mental disorder, for example, they're often in a normal medical ward, often in adult wards, which is exactly where you would not want them to be. And so the problem is at all levels. So we need more child and adolescent psychiatrists. We need more specialized inpatient units. We need more specialized psychiatric nurses. And in many provinces, the problem is much worse than in others. But even beyond that, you know, the World Health Organization, for example, has been pushing this idea of health promoting schools. And we need a different kind of way of using the platform of a school. You know, South Africa has massive, coverage of children, particularly in primary school. Halfway through high school, many adolescents have now dropped out. But certainly in primary school, it's an obvious platform that reaches everybody. And so we need to see mental health and the response to mental illness, for example, about the specialist services. We need them to be in every province. We need them to be in the districts, not just in predominant urban areas like Johannesburg or Pretoria or Cape Town. But we then also need a different way of thinking about schools. We need to think of ways to prevent children or adolescents from dropping out of school. If an adolescent drops out of school at the end of grade 10, for example, the chances of them ending up, using substances, ending up in a gang, ending up a victim or a perpetrator of violence are absolutely massive. Sorry, we are running out of time, Professor, and there's always so much to talk about when we do get to chat. And the child gauge this year does have a lot of information in there, including how discrimination against children with disabilities must be addressed. But I want to just ask you very quickly about the role of the family. We've spoken before about the importance of community, how important that is to South Africa and how we communicate to people at grassroots level, and how perhaps that's been overlooked when government needs to communicate important things. Is mental health for our children and adolescents, is the role of the family within the broader community perhaps a place that should be better used? As you've also mentioned, the role of the school. I mean, I think one of the bylines we used in the gauge was that child and adolescent mental health is everybody's business. This is not just only schools, not just families. It's about all of us, and we need to be thinking about this differently. Yesterday, when we launched the gauge, one of the things I ended up at the end of when I was talking, I was so struck that today was Youth Day. And if you think back to 1976, the position of youth in South Africa, of children and adolescents, was significantly worse. There's no question about that. But there were a couple of things that I think youth at that time had that perhaps we've lost somehow. And despite what was happening then, despite apartheid, despite the horror, that 1976 was about youth and adolescence, and it was about activism. And to be that active, there has to be some sense of hope. one has to have a sense of agency to change things. And I feel that somehow we've lost that, and we need to rekindle that. And I think one of the ways to do that is obviously the family, the schools and everything, but fundamentally it's youth themselves. We have to find a different way to listen to what they're saying, to take their voices seriously and put them at the center.
Great note to leave it on. Thank you so much, Professor Mark Tomlinson, as always, co-director of the Institute for Life Course Health Research at Stellenbosch University, speaking to us there about this year's Children's Institute Child Gauge that was released just yesterday. I'm sure you can find it on various social media platforms if you do want to have a read. A very, very important picture being painted there of, about the lives of the average South African child right now.